Tired of waking up multiple times a night to use the bathroom? If you are a woman over 50, the problem might not be an overactive bladder. It could be menopause-related fluid retention trapped in your legs. In this video, we explore a simple, natural approach to reduce nighttime urination, calm your pelvic floor, and help you get the deep, uninterrupted sleep you deserve. Whether you are dealing with nocturia, swollen ankles, or hormonal sleep disruptions, these techniques will help you regain control of your nights. Let me get straight to the point. Your bladder is not the bad guy here. I know it feels like it is, but honestly, it has almost nothing to do with why you're waking up. If you're tossing and turning, having to run to the bathroom 2, 3, maybe 4 times a night, the real issue isn't even in your pelvic area. Believe it or not, it's actually hiding down in your legs. Because right now, as you're sitting here watching this, water and lymphatic fluid are slowly pooling around your ankles. You see, as we women go through our 50s and beyond, our estrogen levels naturally drop. And when that happens, our blood vessels get a little leaky, letting fluid slip into it, the surrounding tissue. You don't really feel it during the day. It just quietly collects down there. But then nighttime rolls around. You finally lay down flat in bed, and all that trapped fluid suddenly breaks free. Gravity isn't holding it down at your feet anymore, so it rushes right back up into your bloodstream and goes straight to your kidneys. And your kidneys? Well, they don't care that you're exhausted. They just do their job, filtering that extra water and turning it directly into urine. So what happens? You're jolted awake at 2 a.m. and again at 4 a.m. And by the time the sun comes up, you feel like you haven't slept a wink. If that sounds exactly like your nights, well, today we are going to put an end to it. I'm Dr. Jessica Reed. In this video, I'm going to walk you through 3 incredibly simple exercises you can do right in your bed or sitting in a chair. You don't need any special equipment, and honestly, it just takes a few minutes. Most of my patients notice a huge difference in just 3 to 5 nights, simply because we're going to manually squeeze that excess water out of your legs before your head ever hits the pillow. And make sure you stick around, because after the exercises, I'm going to share a very specific bathroom technique, a way of sitting that completely relaxes a tight pelvic floor. It's an absolute game changer for women. I'll also go over a few red flag symptoms you should never ignore. Now, before we jump in, please do me a quick favor. If you find this helpful, or if you just love the idea of natural health solutions for women, please hit that like button and subscribe. That one little click tells the algorithm to share this video with other women who are desperately craving a good night's sleep. Thank you so much. Now let's get started. Okay, let's kick things off with exercise number 3. I like to call this the seated calf pump, and you can just think of it as our warm-up. We need to wake up the blood flow in your lower legs before we try any of the deeper stuff. So, go ahead and sit down in a nice sturdy chair. Put both of your feet completely flat on the floor. Keep your posture nice and tall, and just let your shoulders drop and relax. Now, very slowly, lift both of your heels up off the ground as high as they'll comfortably go. Right at the top there, you should feel your calf muscles tighten up. I want you to hold that squeeze for just 1 little second, and then slowly bring your heels right back down flat. That's really it. Up and down. Up and down. Now, why does this matter so much for us? Well, in the medical world, we actually call your calf muscles your second heart, because when they squeeze, they literally act like a pump, driving stagnant blood and lymph fluid back up against gravity. Since our circulation naturally gets a bit sluggish with age and hormonal changes, we have to give our bodies a helping hand. Because if we don't pump that fluid out now, your kidneys are going to do it for you at 3 a.m. So keep that gentle rhythm going. Up, squeeze, and down. You might even start feeling a little warmth in your legs right about now. And that is a fantastic sign. It just means your circulation is turning on. Aim for about 15 to 20 of these. And hey, if you feel a little cramp trying to start, just stop, wiggle your toes, and join back in when you're ready. All right, great job. Your legs are warmed up, so let's move on to something a bit deeper. Now we are moving on to exercise number 2, which I call the calf wring-out. You can think of this one like giving yourself a deep tissue massage, because even after that warm-up pump, there's usually some stubborn fluid still hiding deep inside your lymphatic tissues. And this is how we're going to physically force it out. You can stay right there in your chair or sit on the edge of your bed. Take your right ankle and just cross it over your left knee, sort of making a figure 4 shape. This leaves your right calf totally exposed and, more importantly, completely relaxed. That relaxed part is crucial because when the muscle is soft, we can really get into that deep tissue. First, let's find the pathway. Take both of your thumbs and press them right into the middle of the back of your right calf. You'll feel a slight natural groove right between the muscles. That right there is your lymphatic highway, A. Now for the squeeze. Wrap both of your hands around the bottom of your calf, right above the heel, like you're grabbing a thick rope. Squeeze it firmly and then slide your hands slowly all the way up toward the back of your knee. Imagine you're wringing out a wet sponge. You're physically gliding that trapped water upward so your core can process it. Do one long, firm stroke, release, and bring your hands back down to the heel, and do it again. Let's aim for about 5 or 6 passes on this leg. Now, please listen carefully because I see women make a couple of big mistakes here. Mistake number 1, never, ever push the massage downward toward your ankle. Our lymphatic valves only open upward. So if you push down, you're fighting your own anatomy, and you'll actually end up with puffier ankles. Always pull up. Mistake number 2, don't just lightly rub the skin. If you're only gliding over the surface, you aren't reaching the water trapped underneath. You need a firm, steady pressure. Nothing painful, just enough to feel the muscle shifting under your hands. Once you've done your squeezes, open your hands up flat. Using your whole palm, just make some long, sweeping strokes from the ankle up to the knee. Just a moderate pressure here, maybe 10 passes. This is your finishing flush to smooth it all out and send that last bit of fluid on its way. All right, let's switch legs. The left ankle go. Over the right knee. Find that groove, give it a firm squeeze from heel to knee 5 or 6 times, and finish up with those 10 flat palm strokes. When you set your feet down, your legs should honestly feel a bit lighter. Your skin might not feel as tight. You might even feel like you need to go to the bathroom right now, which is perfect. That means the fluid has moved out of your legs and is being processed right now, instead of in the middle of the night. Take a nice deep breath and give your legs a little shake. You're doing wonderful. All right, that brings us to exercise number 1. This is the absolute powerhouse of the routine. I call it the menopause leg drain, and it works by combining 3 things: gravity, a specific breathing technique, and a calming body scan. First, let's get into position. If you've got some open wall space near your bed, just scoot your hips somewhat close to the wall and rest your legs up against it. But if that's not comfortable or accessible, no worries at all. Just grab 2 or 3 really thick pillows, stack them at the foot of your bed, and drape your calves right over them. The only rule here is that your feet absolutely must be resting higher than your heart. This is non-negotiable. Once your legs are up, gravity instantly takes over and starts draining all that heavy fluid straight back to your core. Once you're settled, go ahead and place one hand on your chest and the other right on your lower stomach. These hands are going to be your monitors to make sure you're breathing right. Now we add the magic ingredient, the 4-7-8 breath. You know how as we get older, our stress hormones tend to spike in the evening? That's what triggers those awful hot flashes and racing thoughts. Well, this breathing pattern acts like a natural off switch for all of that. Here's how we do it. Breathe in really slowly through your nose while counting to 4. As you do, feel your stomach push up against your hand. That top hand on your chest shouldn't really move at all. We want deep belly breaths here. Now hold on to that breath for a count of 7. And look, if 7 seconds is too long for you today, just hold it for 3 or 4 and work your way up over time. Next, purse your lips like you're blowing through a straw and exhale slowly for a count of 8. Push every last drop of air out until your stomach falls flat. Let's try one cycle together. Inhale through the nose. 2, 3, 4. Hold it right there. 2, 3, 4, 5, 6, 7. And exhale slowly through the mouth. We want to do 4 of these cycles. Studies actually show that just 4 rounds of this breathing activate your vagus nerve, which literally lowers your blood pressure, cools your body down, and gets you ready for deep, unbroken sleep. Go ahead and do 2 more on your own, nice and easy. While you're doing that, keep your eyes closed. We're going to do a quick body scan. It's like turning off the lights in your house before bed, but for your muscles. Focus on your toes and tell yourself silently, my toes are heavy and completely relaxed. Move to your ankles, your calves, and just let them melt right into those pillows. Feel your thighs getting heavy. Picture all that trapped water draining out of your legs like an hourglass, flowing down to your center where your kidneys can handle it right now, instead of waking you up later. Just stay here and enjoy this piece for 2 to 3 minutes. There's no rush at all. Okay, so when you're ready to get up, take it slow. Bend your knees, roll gently onto your side, and use your arms to push yourself up. Sit on the edge of the bed for a few seconds so you don't get dizzy, and then head to the bathroom. Because we just moved all that fluid, your bladder is going to be full. But since this is your final trip before bed, I really want to show you how to do it right using the pelvic floor release. A lot of women over 50 actually suffer from a tight or hyperactive pelvic floor, usually from past childbirth or just hormonal shifts. And when those muscles are tight, your bladder simply can't empty all the way. That's why you sometimes feel like you have to pee again just 10 minutes after you lay down. So here's the fix. First, sit all the way down on the toilet. Please don't hover. Hovering completely tenses up your pelvic muscles. Sit completely flat, lean your torso slightly forward, and just go to the bathroom, normally. But when you think you're done, don't stand up yet. Place your hands on your lower belly. I want you to take a big, slow breath in and actually push your stomach out into your hands like you're inflating a balloon. Then, as you let the air out, just let your shoulders drop. Slump a little bit. Make that entire pelvic area feel incredibly heavy and soft. The biggest rule here is do not push and do not strain. Straining actually clamps everything shut and traps the urine inside. Instead, just relax and let nature take over. By doing this little belly drop, you physically change the angle of your bladder, and you'll almost always find that a little extra fluid comes out. Getting that last little bit out is exactly what buys you those extra hours of deep, uninterrupted sleep. Now, I want to be totally straight with you for a moment. The routine we just went through works absolute wonders if your problem is fluid retention or tight pelvic muscles, which are the most common culprits for women. But it is so important to know that not all nighttime waking is just fluid. There are a few medical red flags you need to watch out for. If it burns or stings when you go, that is likely a urinary tract infection. UTIs are incredibly common as our vaginal tissues naturally thin out after menopause, but they do require a doctor and some medication to clear up. Also, if you're finding yourself excessively thirsty and peeing massive amounts all day and night, that could actually be a blood sugar issue like diabetes, which needs a simple blood test to check. And of course, if your nighttime waking gets suddenly worse, or if you ever see blood or have sudden pelvic or back pain, don't wait around. Call your doctor or gynecologist right away. Think of tonight's exercises like brushing your teeth. It's perfect daily maintenance for your body. But if you've got a cavity, you still have to go to the dentist. So always listen to your body and never feel ashamed to ask for help. All right, we covered so much ground today. We pumped the calves, we wrung out those deep lymph channels, we did the menopause leg drain to calm the nervous system, and we learned how to truly empty the bladder by relaxing the pelvic floor. And listen, you don't have to do it perfectly tonight. If you're exhausted, just prop your legs up on some pillows and do the breathing. Try adding the massage tomorrow. Small, consistent steps make all the difference in the world. The fact that you watched this video all the way through tells me that you care about your body and you aren't giving up on yourself. You truly deserve to wake up feeling vibrant and rested. If we helped you today, please take a second to hit that like button and subscribe to the channel so we can keep growing this community and making more practical health content for you. Trust your body, be patient with yourself, and I wish you a very peaceful, dry, and uninterrupted night of sleep. See you next time.